The pelvic sling is a technique that you can use to create cohesion and containment in the pelvis and in the sacroiliac joints in particular. I learned this technique from a yoga therapist in Alberta, Canada, David McCammond, and he learned it from Dr. Krendekar at a yoga therapy hospital in India. It's a very useful tool, and I've used it to very good effect for people with sacroiliac joint pain, pregnant women, anyone with instability, feelings of instability in the pelvis and in the sacroiliac joints. It's a way of creating externally the ligaments that internally, inside the sacroiliac joints in the pelvis, contain movement, spread forces equally throughout the sacrum and the sacroiliac joint, and also limit movement. So the belts act like external ligaments, especially useful if the internal ligaments aren't doing their job. So if there's been a laxity in those ligaments because of overenthusiastic yoga practices or injury or pregnancy, then the belts can give such relief. Pain can decrease. The habits that might have got you into trouble in the first place, you can recognize them, and the belts will prevent you from going into those habits. So they constrain you, they guide you, and they limit you, just like ligaments do. So they're like yamas in yoga, the restraints. Yeah. So you'll need 2 belts to do this. And it's best if they're at least 6 feet long and they're the same. 2 belts of the same type. So I'm going to show you this up close, so you won't be able to see my face. That's okay. So if you could take the first belt, what you want to be looking at is what's actually going to be happening here. So there's a few tricks to this. First, you want to loop the belt and create a length that will go around your upper thigh. So you want to test that. Well, that's not quite long enough, so I'll make mine a little bit longer. But you don't want it too long, and I'll show you why. So hold the looped end with the clasp facing outward, and then thread the loop end between your legs, and then take the long end in the clasp out to the side and pass it through the loop. So now the clasp is going to be on the outside. So then take all of that and twist it back so that when you pull the belt tighter, this clasp and the loop is going to be behind the greater trochanter. So here's my greater trochanter here. So then you just loop that through so that it doesn't loosen up too much. And then take your second belt and do the same thing on the other side. So again, first you're going to create a doubled belt that is about the size of your upper thigh, and you'll just test that. And see, mine needs to be a little longer. Okay, so then once you have that, turn the belt so that the clasp is facing away from you, and then pass the folded end between your legs again. And then take the long end and pass it through that loop. So then move everything back so that when you tighten it, it's going to be behind the greater trochanter. And then take that long end and over to the clasp on the other side and loop it through. Okay, and then take the long end from that side and loop it through on the other side. So make sure that it's a little bit tight first before you do that. It might have loosened up. And then you tighten both of them. So you want it snug, but not uncomfortable. So you can see that these are both behind my greater trochanters. Actually, this one could be a little bit farther behind, but that's good enough. So it should feel quite snug and stable. So what these belts are doing is they're creating stability through the sacroiliac joints, through the pubic symphysis, through the hip joints, and it can create an integrity in the joints. So once you've got the belt on, you can do a short stance, standing vinyasa, standing posture vinyasa. You can wear the belt around your house. It can give you immense relief. Or you can just wear it for a short time during your yoga practice and feel how it helps to limit, so your postures won't be as grand or as spectacular, but you will maintain integrity, you will maintain more stability in your pelvis and in your sacroiliac joints, and more integrity. So have fun with it.